When you look at something like a dilated pore of Weiner, it's easy to assume it showed up suddenly or that it's just a really big blackhead that formed overnight. But these things are slow builders. They take their time, growing quietly under the surface long before they ever become visible. And that's where the story really begins, with the way the skin functions, changes, and adapts throughout our lives. A dilated pore of Weiner starts as an ordinary hair follicle, but over years of repeated clogging, sun exposure, and natural aging, that follicle slowly stretches wider and wider. The opening expands, the walls weaken a bit, and the debris inside starts to compact and harden. It's not dramatic, it's not painful, it's not the kind of thing most people even notice, but it's happening. And once that pore becomes wide enough, the trapped buildup starts acting like a little anchor, keeping the pore stretched and making it harder for the skin to tighten back down on its own. What fills that pore is mostly keratin, the same protein that makes up your hair and nails. It mixes with oil, dead skin cells, and a little environmental debris, forming this dark oxidized plug that sits right at the surface like the tip of an iceberg. But the part you can see is only a fraction of what's inside. Most of it sits deeper, compacted over time, forming a solid core that's way firmer than the kind of blackheads you might squeeze at home. That's why when people come in and tell me they've been trying to push it out for years, nothing happens. There's too much density, too much depth, and the pore itself simply won't allow the plug to slip out easily without the right technique. A big reason these pores become dilated is sun exposure. UV rays break down collagen, and collagen is what gives your skin structure and keeps pores tight. As collagen weakens, pores lose some of their support and start to stretch more easily. Combine that with years of small, repeated blockages, and the follicle slowly transitions from a regular pore into a much larger cavity. It doesn't matter how clean you are or how well you take care of your skin. This can happen to anyone, especially as the skin matures. Genetics play a role too. Some people just naturally develop thicker, more keratin-filled plugs. Others have oilier skin or slower cell turnover, which increases the chance of buildup. What makes these spots so fascinating is that they usually don't cause symptoms. No pain, no redness, no irritation. Just a little dark mark that most people ignore until one day they catch it in a mirror with brighter lighting and think, how long has that been there? And once they notice it, they can't unsee it. It becomes the thing they fixate on. I hear that all the time. I swear it wasn't this big a year ago. But usually it was. The change is just so gradual that the eye doesn't track it. By the time someone finally seeks help, they've usually tried everything at home: scrubs, masks, pore strips, cleansers, but none of those things can actually reach the deeper part of the plug. So instead of improving it, they just irritate the surrounding skin or push the top layer down tighter. And the pore keeps stretching because the core inside keeps acting like a mold holding everything open. That's why understanding how it forms is so important. You can't fix what you don't understand. The decisions you make about your skin, what you squeeze, what you pick, what you ignore, all have long-term consequences, and this is a perfect example. When you take the time to explain the biology behind it, people start to realize this isn't a failure of hygiene or a sign of unhealthy skin. It's just skin doing what skin does over time. It adapts, responds, and sometimes gets stuck in a pattern it can't undo without help. And once you understand the why, the path to safe, effective treatment becomes a whole lot clearer. You stop fighting the skin and start working with it. A dilated pore of Weiner isn't just a giant blackhead. It's a long-term story written inside the skin. And when you know how that story begins, you know exactly how to bring it to a clean, satisfying ending. When most people first see a dilated pore of Weiner, their immediate reaction is, oh, that's just a huge blackhead. And I understand why. It looks like the same thing they deal with on their noses or chin, just on a bigger scale. But once you look a little closer, you realize it's a completely different creature. A normal blackhead sits fairly close to the surface. It's soft enough that with the right prep, a little pressure and clean technique, it usually slips out without much resistance. But a dilated pore of Weiner doesn't behave like that at all. It's deeper, older, and far more stubborn than anything you're used to seeing at home. A regular blackhead forms when oil and dead skin cells clog a pore and the top oxidizes, turning that familiar dark color. It's mostly superficial, almost like the pore is asking to be cleared. But a dilated pore of Weiner is more like the pore has become a storage space. Over time, layer after layer of keratin builds up, compacting inside the follicle the same way sediment settles at the bottom of a river. Instead of staying soft and malleable, it becomes dense, even rubbery, and because it forms slowly over years, not days or weeks, it acts like a plug that anchors itself in place. That's the part many people don't realize. They think if they push hard enough or use the right tool, they can pop it out just like any blackhead. But the density and depth make that nearly impossible. One of the ways I explain the difference is by describing the shape. A normal blackhead is usually small and tapered. It doesn't extend very far beneath the surface, but a dilated pore of Weiner often has a long cylindrical core that reaches much deeper than the surface gives away. What you see on top is just the tip. The real bulk of it lives beneath, firmly attached. That's why people can press until their fingers hurt and still get nothing. The surface dark spot is misleading. It doesn't reveal how substantial the foundation is below, and then there's the pore itself. With typical blackheads, the pore will often tighten back up after extraction because the surrounding skin still has structural elasticity. But with a dilated pore of Weiner, the opening has stretched far beyond its normal size. The skin has adjusted to the presence of that plug, and it's not able to snap back in the same way. That's part of what distinguishes these two conditions. One is a temporary blockage. The other is more like a permanent alteration of the pore, not dangerous, but certainly persistent. People also tend to think blackheads and DPWs respond to the same treatments. If salicylic acid helps with blackheads, shouldn't it help with this? But a dilated pore of Weiner doesn't soften or shrink much with topical products. It's too deep and too established. Exfoliating products help prevent new clogging, but they won't dislodge something that has been sitting inside the skin for a decade or more. That's why trying to treat it like an ordinary blackhead leads to frustration. You're applying all the right steps to the wrong problem. What makes this difference so important is safety. When someone mistakes a dilated pore of Weiner for a simple blackhead, they tend to treat it aggressively. They squeeze harder, they dig, they use sharp tools they bought online, and all that force doesn't remove the core, but it does injure the surrounding skin. I've seen people give themselves scars, infections, and permanent discoloration because they were convinced. They just needed to try a little harder. Understanding that a DPW isn't built like a blackhead changes the entire approach. It shifts the focus from force to precision, from pushing to guiding. It also helps explain why the extraction is so satisfying to watch. When that core finally releases, it often comes out as a single intact piece instead of breaking apart the way a typical blackhead does. There's this moment where the skin lets go, and suddenly the pore looks dramatically different. That's the part people love, the part that feels like a tiny transformation right before your eyes. But that moment only happens cleanly when the difference between the two is respected. Recognizing that a dilated pore of Weiner is not just a large blackhead, but a fundamentally different type of lesion changes everything. The technique, the expectations, and the outcome. And once you understand that difference, you know exactly why these extractions feel like such a powerful reset for the skin. When people see a dilated pore of Weiner, their first instinct is almost always the same. They want to get it out themselves, and I get it. There's something tempting about thinking you can just squeeze a little harder, press from a slightly different angle, or use whatever tool you saw online to pop it free. But this is where things can go wrong very quickly, because the techniques that work fine for a small surface blackhead simply aren't enough or safe for a deep, compacted core that's been sitting inside the skin for years. The skin around a dilated pore of Weiner may look calm on the outside, but underneath, it's holding onto that plug with surprising strength. And trying to force it out without the right method is like trying to pull a cork from a bottle without ever breaking the seal. You end up putting more and more pressure on the surrounding tissue, and the only thing that gives way is the skin, not the plug. This is where professional extraction becomes so important. When you've spent years working with pores, you learn to read them almost like their own little language. You can see where the skin is flexible, where it's tight, how deep the blockage sits, and what direction the follicle grows. Every pore is built slightly differently, and understanding those little variations is what makes the process smooth instead of painful or damaging. A dilated pore of Weiner isn't removed with brute force, it's removed with controlled, steady tension. that takes advantage of the pore's natural anatomy. The pressure isn't random, and it's never aggressive. It's placed in a way that gently widens the existing opening, creating just enough space for the core to slip out without tearing the skin a knot. Her important part is preparing the area properly. Softening the skin matters more than most people realize. Warmth, cleansing, and the right tools help loosen the very edges of that compacted keratin. It's a subtle change, something you wouldn't notice just by looking, but it makes a huge difference in how willingly the pore releases its contents. When you skip preparation, the core stays firm and the pore stays tight. That's why squeezing at home so often ends in redness, swelling, or even bruising. The skin wasn't ready and the pressure wasn't guided. Professional extraction also gives you the ability to stabilize the skin, which is something many people struggle with on their own. When you anchor the surrounding tissue correctly, the pore stays open and supported, which prevents unnecessary trauma. It's like holding a door steady while you guide something through it. Without that support, the surrounding skin collapses inward and the pressure you're applying just pushes the blockage deeper or widens the damage. That's how scars and depressions form, not because the pore was dangerous, but because the technique wasn't right. Then there's the issue of tools. At home, people often use their nails or cheap extractors that aren't shaped to support the skin. In a clinical setting, the tools are designed with precision, rounded edges, smooth surfaces, and angles that distribute tension instead of concentrating it. Even something as simple as the difference between a sharp corner and a curved one can change the entire outcome. The goal is always to guide the core out intact, not to crush it or tear it apart as it comes through the pore. And the right tool in the right hands makes that possible. One of the biggest benefits of professional extraction is that it decreases the risk of infection. When someone presses too hard at home, especially with unclean tools or nail, bacteria can be introduced into the pore, turning what was a harmless buildup into an inflamed lesion. In a sterile environment, the skin stays protected, and once the core is removed, the area gets cleaned thoroughly so the pore can begin the healing process without complications. It's simple, but it makes all the difference. Speaking of healing, a careful extraction sets the stage for the pore to tighten over time. When the core comes out cleanly and the skin isn't torn or irritated, the opening has a much better chance of shrinking as collagen naturally reorganizes. When someone digs or squeezes harshly, the damage they create can actually make the pore appear larger in the long run. That's something people don't realize until it's too late. Professional technique isn't about making the process fancy, it's about making it safe, effective, and clean. And when you respect the structure of the skin and the nature of a dilated pore of Weiner, you give the pore the best possible chance to return to a smoother, healthier state. That's the power of doing it right. When it comes time to actually remove a dilated pore of Weiner, the process might look simple from the outside, but there's a lot of intention behind every step. Nothing is rushed, nothing is guessed, and nothing is done without first understanding exactly what the skin needs in that moment. The very first part of the process is preparing the area so it's ready to release the core without unnecessary resistance. That means cleansing the skin, softening the surface, and giving the pore a chance to relax a bit. Even though you can't see that change happening visually, the skin becomes more flexible, more cooperative, and less likely to tear. Preparation is really the quiet foundation that makes the rest of the extraction smooth and safe. Once the skin is ready, the next part is to assess the direction and depth of the pore. Every pore sits at its own angle, and understanding that angle is the difference between guiding the core out cleanly and pushing against it in a way that makes the skin tighten. With a dilated pore of Weiner, you don't want to force anything. You want to follow the natural architecture of the follicle. That means positioning your hands or instrument in a way that works with the pore instead of fighting it. Even the slightest shift in pressure can change how easily the core moves. Then there's stabilizing the skin around the pore. That's something most people don't even think about, but it's one of the most important steps. When you hold the surrounding skin firmly but gently, it gives structure and support to the area. It keeps the opening steady and prevents unnecessary strain. Think of it like holding a jar still while you twist the lid. The stability is what makes the movement smooth. Without that support, all the pressure goes into the skin, and that's when irritation or tearing can happen. When it's finally time to apply pressure, it's done gradually and in a very controlled way. The goal isn't to push the core out with force. The goal is to coax it out with the least amount of tension possible. Gentle, consistent pressure widens the natural opening just enough for the compacted keratin inside to start loosening. With a dilated pore of Weiner, the plug has often been sitting there for years, so it's attached pretty firmly. But when the pressure is applied correctly, the skin responds by letting go little by little instead of resisting. And that's a moment you can feel. The pore begins to soften internally even before anything moves on the surface. Eventually there's a point where the core starts to shift. It's subtle at first, almost like the skin is taking a breath. The core releases from the deeper part of the follicle and then it begins to slide word. This is where the steady pressure really matters. Too much force and the surrounding skin gets irritated. Too little and the core can slip back into place. When done right, the movement is smooth, controlled, and steady the whole way up. The key is to let the pore open around the core instead of pulling the core through a space that isn't ready. As the core comes through the opening, you want it to maintain its shape as much as possible. Not because the shape matters aesthetically, but because removing it intact means the entire blockage has been released. When the extraction is careful and deliberate, the pore is cleared completely, leaving nothing behind that could recompact or cause new congestion. It's a satisfying moment for a reason. It represents a full release, not a partial one. Once the core is out, the job isn't finished. The pore needs to be cleaned so the skin has a fresh start. A gentle cleanse, sometimes followed by a light topical treatment, removes any remaining debris and helps reduce the chance of irritation. The skin is then allowed to relax, and the pore begins the process of tightening back down over time as collagen restructures. The way the core is removed determines how cleanly this healing process happens. When the extraction is careful, the skin settles smoothly. When it's rushed or aggressive, the pore may not recover as well. The entire extraction isn't about getting something out of the skin, it's about doing it in a way that protects the skin, respects its structure, and leaves it healthier afterward. That's the difference between a quick squeeze and a true controlled extraction. And that's why the process matters every single time. Once the core of a dilated pore of Weiner finally releases and lifts out of the skin, there's this moment of almost instant relief. Not physically, but visually. The pore looks open, clean, and Sudha lie much deeper than anyone expects. And that's completely normal. What people often forget is that the core that just came out acted like a long-term placeholder. It sat inside that pore for years, sometimes decades, and the skin gradually shaped itself around it. So when it's removed, the pore looks like an empty little tunnel at first, and that can surprise people who thought the opening would shrink immediately. The skin just needs time to recalibrate. It's been stretched for so long that it won't bounce back instantly, but that doesn't mean it won't tighten. It just means the healing process is only beginning. One of the most important things after an extraction like this is how you care for the area in those first few minutes and the days that follow. Immediately after the core comes out, the surface of the pore is vulnerable. It's clean, but it's also open, and that makes it the perfect moment to gently cleanse and protect it. Keeping the area free of bacteria is essential because an open pore is like a freshly cleared pathway. Anything you introduce to it can settle right in. A light, soothing topical helps calm the skin and reduces the chance of irritation. This isn't the time for harsh scrubs, strong acids, or anything that forces the skin to do more work than necessary. The goal is to let the pore relax and begin its natural healing process without interruption. Over the next few days, the pore begins to slowly tighten as the skin reorganizes itself. Collagen starts to contract and rebuild around the opening. This process is subtle and you won't notice a dramatic change right away, but little by little the pore becomes less noticeable. The cleaner the extraction and the gentler the aftercare, the smoother this healing phase tends to be. When the skin isn't irritated or damaged, it has a much easier time closing in on itself. That's why technique matters so much during the extraction. Clean removal sets the stage for clean healing. Some people expect the pore to close completely, almost like it never existed. But that isn't always how the skin works. A dilated pore of Weiner leaves behind a space that's been stretched for a long time. The skin will tighten, but it may not return to the same tiny size it once had when the follicle was normal. What it can do, though, is become smaller, smoother, and far less noticeable. Most people are amazed by how much the appearance improves once the skin has had a chance to settle. A pore that looked like a dark, prominent spot before extraction can look like a faint, shallow indentation afterward, and with time, even that softens. This is also where future habits play a role. Protecting the skin from the sun helps tremendously. UV damage weakens collagen, which is the scaffolding that keeps pores tight. If you keep that structure strong, the pore has a better chance of staying smooth and refined. Gentle exfoliation helps prevent new buildup from settling into the same spot. Consistency is more important than intensity. It's the regular, steady care that keeps the skin clear rather than any aggressive treatment. One thing that surprises people is how often a dilated pore of Weiner stays away once it's removed properly. Because the entire keratin core has been extracted, there's no remaining debris to act as a starter for a new one. If the pore is cared for and protected, especially in those first few weeks, it usually stays in a much healthier state. The skin may still have a slight mark where the pore once was, but it's nothing compared to the deep, dark plug that sat there before. People sometimes ask if the pore will refill immediately, and the answer is no, not if the extraction was complete and the skin is kept clean. What they're noticing is usually normal oil production or a bit of surface debris, not a new compacted core forming. It's easy to confuse everyday skin texture with a problem returning, especially when you've been focused on the area for so long. But the pore itself doesn't just recreate a dilated core overnight. These things take years to develop, not days. So the best thing someone can do is treat the area gently and trust the healing process. Watching the skin transform after removing something that's been sitting there for so long is incredibly satisfying. It's a reminder of how resilient the skin is and how much it can improve when we work with it instead of against it. Clearing the pore is only the first step. Giving the skin the space and care to recover is what brings the real, lasting change. And that's why every extraction is more than just removing a blockage. It's giving the skin the chance to reset and renew. When someone comes in with a dilated pore of Weiner, one of the first questions they ask after the extraction is, how do I stop this from happening again? And the truth is, while you can't control every factor like genetics or natural aging, you absolutely can support your skin so that buildup is less likely to settle deeply again. Prevention isn't about doing one dramatic thing. It's about small habits that keep your pores functioning the way they're meant to. And the goal isn't to chase perfect skin. It's to give your skin the consistency and support it needs to behave predictably, heal well, and stay as clear as possible. The first part of that prevention is simple but powerful, keeping the pores clean on a regular basis. When oil, dead skin cells, and environmental debris sit on the surface for too long, they slowly settle inside the follicle. For most people, that leads to small blackheads, but for someone whose skin tends to form deeper, firmer plugs, those tiny accumulations can become the first building blocks of a much larger problem. A gentle cleanser used consistently, not harsh scrubs, not products that strip the skin, helps reduce the amount of material that can settle into the pores in the first place. When the skin isn't irritated, it turns over better. When it turns over better, it sheds more evenly. And when it sheds more evenly, pores stay clearer. Another useful habit is incorporating exfoliation in a way that suits your skin type. Exfoliation isn't about scrubbing as hard as you can. It's about helping the skin release dead cells before they compact inside the pores. Some people benefit from chemical exfoliants that dissolve buildup gently. Others prefer mild physical exfoliation a couple of times a week. What matters most is that it's done regularly and gently without overwhelming the skin. Over-exfoliating actually has the opposite effect. It irritates the skin, increases oil production, and can make pores appear even larger. But the right balance keeps the follicle clear and discourages the kind of long-term buildup that creates a dilated pore of Weiner. Sun protection is another key part of preventing deep congestion. It might not seem connected at first, but UV exposure weakens the collagen around the pore. Collagen is what keeps pores firm and tight. When it breaks down, the pore loses some of its structure and becomes more likely to stretch over time. A stretched pore has a width, R opening, which makes it easier for debris to settle inside and harder for the pore to tighten naturally. Something as simple as wearing sunscreen daily helps protect that collagen, keeping the skin supported so pores stay healthier and more resilient. It's one of those habits that pays off quietly in the background, but it makes a huge difference over the years. Knowing what not to do is just as important as knowing what to do. Trying to squeeze at home, especially when something is deep or firm, leads to more stretching, more trauma, and more risk of scarring. The skin remembers that damage. When you force a pore open repeatedly, it doesn't return to its original size as easily. So prevention also means resisting the urge to pick, squeeze, or dig, especially in spots where the pore already has a history of deep congestion. If something looks like it's forming again, the safer choice is always to treat it gently and, if needed, get it evaluated. Moisturizing is another part people often overlook. When the skin is dry, it compensates by producing more oil. And when the oil becomes thicker, it traps dead skin cells more easily. A lightweight, non-comedogenic moisturizer keeps the skin balanced so it's not overproducing oil or shedding in an irregular pattern. When the skin is hydrated, pores work the way they're supposed to. They open and close naturally. They release oil more efficiently. Everything becomes more predictable, and that predictability helps prevent deep buildup. What ties all of these habits together is consistency. You don't need a complicated routine with 10 different products. You just need steady care, cleansing, gentle exfoliation, sun protection, and habits that respect the skin instead of overwhelming it. The skin responds best to routines it can rely on. When you give it that kind of stability, it stays calmer, clearer, and far less likely to build up the kind of dense keratin core that forms a dilated pore of Weiner. The best prevention is simply creating the kind of environment where your skin can stay clear without being pushed, stressed, or irritated. And when you do that, you give your pores every chance to stay clean, healthy, and free from the deep congestion that takes years to form.